I'm Jane Clapham. I'm the lead EB nurse specialist here at Guy's and St Thomas's.
So I'm Rachel Box. I'm a clinical specialist occupational therapist and I specialise in hand therapy. So I've been working in the EB adult service for the past 10 years.
We go out to see our patients in their own homes, and we have these big clinics once a month for the more complex patients. We run other clinics as well.
People come here for 6-month or yearly reviews in clinic.
The Rare Diseases Centre opened November 2017. It was a long time in the planning, and the funding for this lovely centre has come from charitable sources. The clinics are multidisciplinary for the complex patients, so we have a dietician, a hand therapist, a physiotherapist, ophthalmology, dental, plastic surgery, psychotherapy, so lots of us. And the patients get to see the whole team on one visit, which is really nice because they come from quite a distance, some of them. So they come for a whole day. Sometimes they stay in the patient hotel overnight, and they get to see all the professionals they need to in one day.
So what we really wanted was a more holistic healing kind of space for people to be in. So whilst in the clinic rooms we can do all the sort of procedures and things that need to be done, the waiting area is designed to be very comfortable. It's designed so that individuals and families can mingle and meet each other, because I think if you've got a rare disease you might feel like you're the only person, but having a space where you can meet other people who have that same kind of problem that you have can be sort of very affirming and very helpful for people.
There is no training you can have to learn about EB, so you learn on the job, and because you get to know the patients so well, they expose themselves physically and emotionally to you. The relationship we have is completely different to any other relationship that I've had with patients in the past. They have to trust you. They have to know that you're going to be there.
Obviously in between clinics people will email me if there are any changes or if they need any advice. So people can always contact me between clinic appointments.
Sometimes they've had a poor experience of health service in the past, where professionals haven't understood about EB, and it needs a completely different handling. Sometimes their choices are not what you think is the right choice, but it's their choice. So for example, I would think a particular dressing isn't right for that person, but if that's the dressing they want to use and they understand the options but they still choose that dressing, I think that we must respect that.
Patients with EB, they're experts in their condition.
I have problems that some of my fellow EB friends don't have, but equally I'm lucky and I don't have some of the horrific things that they go through.
As part of our project, patients participated in the project, so we, in terms of the hand therapy assessment, they helped us develop that, and we piloted that with patients. So we know that the language was easy to follow.
At the end of my working day, I can go home and live my life. They can't. They live this life all the time, so it has to be their choice.
I asked Chelsea, are you okay with that, Chelsea? Will you try? They don't just, say this is what
sending on her and say you've got to do this. They'll ask her if she's happy to do it.
I hope I understand what they need most of the time now, because I've been doing it a long time. But you have to invest time and effort into making that relationship. It doesn't just happen overnight. In the severe forms of EB, they live with the knowledge that their life is almost certainly going to be shortened by the disease. And so when that end comes, it's only natural to be very saddened by it. And so you need the support of your colleagues to help you through those difficult times. Otherwise you couldn't do the job. We meet with a clinical psychologist once every couple of months and talk about all the issues that are raised about being an EB nurse and the challenges we face. And for me, that provides me with my professional mental health, because it would be very easy to burn out in this job. It's the worst job and the best job I've ever had, and I have laughed and cried with my patients more than in any other job, but I don't want to do another job. This is, for me, the best job in nursing.